So we have discussed about phagocytosis. Similar to the phagocytosis, there are two more things which we need to discuss, right? These two entities are neutrophilic extracellular trap and imperipolysis, right? So first I will discuss about imperipolysis. So these are some of the important topic which examiner ask in exam, right? Imperipolysis. Imperipolysis was the question in this AIMS exam also, right? So it's a very important topic for exam. As you have seen in this AIMS exam also, they had asked regarding imperipolysis. There was a diagram, right? So what do you mean by imperipolysis? What do you mean by imperipolysis? Suppose I am showing you a cell. This is the cell, and say okay, this is the nucleus of the cell, right? This is the nucleus of the cell. So what is imperipolysis? Active penetration of a cell and then exit from this cell without changing their morphology or physiology. So that is the definition of imperipolysis. Again, I will repeat. What is imperipolysis? Active penetration. See what I am saying, active penetration of a cell. So active penetration of a cell into another cell, right? So active penetration of a cell into another cell and exit without change in morphology or physiology. Morphology or physiology. So without changing morphology or physiology. So this is the definition. This is the definition of the imperipolysis, right? So imperipolysis is active penetration of one cell into another cell and then exit without changing their morphology or physiology, right? So that is the important thing. See what I am emphasizing. It is a penetration of one cell into another cell and then exit. Exit is what type of exit? Without change in morphology or physiology. That is important to understand, because this is the point of difference which you will not see in phagocytosis. In phagocytosis, once cell has been taken inside, they will be killed and they will be degraded. So there will be no cell who is coming outside, right? So there will be no cell who is coming outside. When it will be coming out, it will be coming out as a debris, right? So that is the important thing, without change in morphology or physiology. So here I was showing you one cell, and now you can see I am just making another cell. This is the lymphocyte. Suppose this is the lymphocyte, and now this lymphocyte is penetrating this. So it is inside. So this is the lymphocyte inside the cell. So this lymphocyte has entered inside the cell, and after entering, it is coming outside the cell as same as it has gone inside. The same lymphocyte has come, right? So this is called imperipolysis, active penetration of a cell into another cell without coming outside the cell without changing their morphology or physiology. But in case of phagocytosis, they will be killed at this place itself. They will not be coming out like this. So that is the difference between imperipolysis and phagocytosis. So what are the examples of the imperipolysis which we have to keep in mind, right? Example of the imperipolysis is the megakaryocytic imperipolysis, which you see in myelodysplastic syndrome. Myelodysplastic syndrome. This was the question in All India exam 2014. Myelodysplastic syndrome, megakaryocytic imperipolysis will be seen. Lymphocytic imperipolysis will be seen in chronic lymphocytic leukemia, CLL, right? So chronic lymphocytic leukemia, you will be seeing lymphocytic imperipolysis. And another important thing where you will find is a very important, and when I will discuss in liver pathology, that time also again I will mention this autoimmune hepatitis. So it is one of the characteristic histological finding of autoimmune hepatitis, right? So these are the three examples which I have enumerated for the imperipolysis. active penetration of a cell into another cell, coming out of the cell without changing morphology or physiology. And these are the examples. So this is the emperipolysis, and here I would like to show you the diagram of emperipolysis. Look at this picture which I am showing you. This is the important bone marrow aspirate, and I am showing you here it is the megakaryocyte. It is the megakaryocyte, right? This is the megakaryocyte, right? Inside the megakaryocyte, see, this is the nucleus of the megakaryocyte, and now you can notice there is a cell here. There is a cell here which is entering into this cell. So that is the neutrophil. Neutrophil is coming inside this. So you see, neutrophil is coming inside the cell. So inside the megakaryocyte, neutrophil is there, and after some time it will come outside as intact. That is called as emperipolysis. So this is the picture of emperipolysis. Without change in morphology and physiology, they will come outside also like this, right? So this is about emperipolysis. Another important topic for all India exam point of view, which examiner asks is NET, right? Neutrophilic extracellular trap. So another topic is the neutrophilic extracellular trap, NET. This was the question in All India exam 2013. That was a simple question. NET stands for, or NET is associated with. That was the question. So we have to remember that NET is associated with neutrophil, and this is called as neutrophilic extracellular trap. So this is the full form of NET, neutrophilic extracellular trap. So neutrophilic extracellular trap is the full form of NET, neutrophilic extracellular trap. So why it is called as neutrophilic extracellular trap? If you look at the cell, if you look at the neutrophil, we all know that neutrophil nucleus will be having 3 to 5 lobes. So here we are seeing that neutrophil nuclear chromatin has come outside, right? So chromatin has come outside. This is the nuclear chromatin. So outside, that is why it is called as neutrophilic extracellular. Why it is called as trap? Because they will be trapping antigen into them. So this will be trapping antigen into them. That is why it is called as neutrophilic extracellular trap, right? To understand this, first we should understand what is the pathogenesis. What is the pathogenesis of or mechanism of formation of neutrophilic extracellular trap? So whenever we are exposed to the bacterial antigen, or you can say microbial antigen, or you can say microbial antigen. So whenever bacterial or microbial antigen is exposing our cells, especially neutrophil, their lipopolysaccharides and the cytokine which is called as interleukin 8, that is very important to understand. And this cytokine could be a future All India question also. This is the interleukin 8. So which cytokine is most important in formation of neutrophilic extracellular trap? That will be the interleukin 8. So interleukin 8 is the most important cytokine for the neutrophilic extracellular trap formation, right? Now we will see. So when lipopolysaccharide or interleukin 8, which has been activated by bacteria or microbial antigen, they will activate. So now they will activate neutrophil, right? Suppose I am making another neutrophil. So as I said, because of the lipopolysaccharide and interleukin 8, they will be activating neutrophil. And inside the neutrophil, as I am showing you here, this is the small nucleus. Just for the understanding point of view, I am making it is a small nucleus, and we all know that neutrophil is having granules, right? So they will be having granules. One type of granule which I am making brown. There is another type of granule which I am making in different colors, that is the green color, right? This is the another granule, and there are certain other granules which are like this. So these are the 3 types of the granules I am showing you, right? While these 2 granules are actually enzyme granules which is containing NADPH oxidase, right? One is containing NADPH oxidase, right? So when neutrophil is getting activated, NADPH oxidase will be activated and released from the granule. And second thing is this green one is the PAD4, PAD4. So these are the two important enzymes which are involved in neutrophilic extracellular trap formation. So what are these two enzymes? One is NADPH oxidase, second is PAD4. PAD4, so these are two enzymes which are present in neutrophil, NADPH oxidase and PAD4. PAD4 stands for protein arginine deamidase, right? So this is the enzyme name, right? So protein arginine deamidase. So and this protein arginine deamidase and NADPH oxidase, what they are going to do, they will be having two function, and this one is this one which I have shown in purple color. This is the lysosomal granule. This is the lysosomal granules, right? Lysosomal granules which will be having myeloperoxidase and lactoferrin. All these enzymes will be present. So lysosomal granules are present which are having myeloperoxidase and lactoferrin, right? Which will be having myeloperoxidase and lactoferrin. So this is the simple thing which I wanted to show you in the development of neutrophilic extracellular trap. So after this activation, what will happen? After this activation, this NADPH oxidase and protein arginine deaminase 4, these two enzymes, what they are going to do, they are going to cause two impact. Number one, they will cause rupture of lysosomal granule. So first they will cause rupture of the lysosomal granule, and second they will cause citrullinaization of the histone protein, right? So now they will be causing citrullination. Second thing what they are going to do is the citrullinization of histone protein, right? So citrullinization of the histone protein, this was the question in All India exam. Citrullinization was the question in All India exam ki what will happen in NET formation. Citrullinization of histone occurs in NET formation. So because of citrullinization of histone, what will happen? There will be a decondensation of chromatin. Decondensation. This will lead to decondensation of chromatin. And after this decondensation of chromatin, what will happen? The histone protein will be having breakdown. So this will form histone breakdown products, right? So they will be producing histone degradation products, right? So this is how histone degradation products will be formed. So because of the citrullination of the histone, chromatin will be decondensed, chromatin will be dispersed, histone products will be exposed, and this exposed histone byproducts will be adhering or which will be containing all these lysosomal granule substance components. Lysosomal granule substance will be having myeloperoxidase, lactoferrin or lysozyme. So all these things will be entrapped in all this histone. So now you can see, again I will show you what was going on in the pathogenesis of neutrophilic extracellular trap. As I said, the neutrophil is having NADPH oxidase and PAD4 along with the lysosomal granules. So because of the activation by interleukin 8 or lipopolysaccharide, these enzymes, they are causing two things. Number one, rupture of the lysosomal granule, and number two, citrullination of the histone protein. So because of this, what will happen? Now you can see this is the neutrophil, and now entire chromatin will be coming outside, right? So now we can see the entire chromatin is coming outside the neutrophil, right? This chromatin is having histone degradation products. This chromatin is having histone degradation products, right? Histone degradation products, and these histone degradation products will be having lysozymes or lysosomal granules product, right? So these are the lysosomal granule product. So histone is sticky, lysosomal granules are present, so this will trap the antigen. Now this will trap the antigen. So this is how antigen will be trapped. Antigen will be trapped inside this. Antigen will be trapped inside this, and after that these granule component will be killing them. This is how they will be destroyed, right? So microbial antigen will be killed. So this is how microbial antigen will be destroyed, right? So microbial antigen will be destroyed or destructed by this neutrophilic extracellular trap. So by seeing this, we can easily make it out. Okay, what is the function of neutrophilic extracellular trap? So what is the function of neutrophilic extracellular trap? So what is the function of neutrophilic extracellular trap? So number one important function of neutrophilic extracellular trap is antimicrobial. So antimicrobial function, because they are killing the microbial antigen, so they are protecting. So protective function is the most important function. So remember this protective function, right? This is the protective antimicrobial function, and this was the question in DNB exam. What is the most important function? And this is the most important function of neutrophilic extracellular trap. So they will be trapping the antigen and they will be destroying them and they will be killing them. This is the most important function of the extracellular trap, neutrophilic extracellular trap, antimicrobial function. Remember, apart from this, what we need to understand, this nucleus will be exposed, and see this, I said nuclear chromatin will be exposed, and this nuclear chromatin can provoke to form anti-nuclear antibodies, right? So because nuclear chromatin has been exposed, so definitely they will be behaving like an antigen. So for an antigen, what antibody will be formed? Anti-nuclear antibody. So when anti-nuclear antibodies are formed, so what disorder you see? SLE-like disorder, like scleroderma-like disorder. So what are these disorders? Autoimmune disorder. So that is why NET is also associated with autoimmunity. So they are associated with autoimmunity. Third thing, they can induce thrombosis also. So they can induce thrombosis also. NET can induce thrombosis also, and that is why they are also associated with deep vein thrombosis. Right? So these are the three important functions of the neutrophilic extracellular trap. But out of these three important functions, what we need to remember, most important function is the antimicrobial function, which is protective function, right? So now we can see that what are the question examiner had asked from the neutrophilic extracellular trap. If you remember from the beginning, what I have told you, this can be a future question also. Most important cytokine for the neutrophilic extracellular trap formation is the most important cytokine for the neutrophilic extracellular trap formation is the interleukin 8, right? What is going on in histone? It is citrullinarization, which was all India question. What is the most important function? Most important function is antimicrobial function, because all chromatin is coming outside. So as a result, nucleus will be gone, so life of cell will be gone and cell may be dead. So neutrophil will be dead. So that is why this type of suicide. So this is a kind of suicide. So this neutrophil is committing suicide for benefit of our immune system. That is why NET is also called as beneficial suicide. This is also known as beneficial suicide. So NET is also associated with beneficial suicide, right? So this point also we have to keep in mind. So here I am going to show you a image of neutrophilic extracellular trap. This is a special microscopy which is called as immunofluorescence microscopy, right? So this is the immunofluorescence microscopy, right? So what I am going to show you here is called as immunofluorescence microscopy. In immunofluorescence microscopy, we can see The background is dark and only two colors are allowed to pass through. Background is dark, only two colors are allowed to pass through. In this case, we are seeing green color, and red color. So only two colors are passed through because immunofluorescence microscopy, they use one mirror that is called as dichroic mirror, right? Dichroic mirror is used for immunofluorescence microscopy. Similar type of image was shown in AIMS exam and question was asked, for this type of microscopy which of the following is used? So dichroic mirror is used. As you can see, the name itself is reflecting dichroic, dichrome, two colors. Rest of the things has been blocked, right? Now coming to these two important cells, 1 and 2, these are normal neutrophil. So what I am showing you in this diagram, normal neutrophil, where green color is cytoplasm and red color is the orange color, or red color is the nucleus, right? So this is the nucleus, this is the normal. What happens when you are looking into this diagram? This is the neutrophilic extracellular trap. So this diagram is for neutrophilic extracellular trap. You can see the number 1 neutrophil which I am marking here. In this neutrophil you can see only cytoplasm which is green in color. Where is the red nuclear chromatin? Red nuclear chromatin is, you can see from here, it is coming outside. So you can see here it is coming outside, and this is the nuclear chromatin. You can see it is coming outside and they are trapping antigen into them, and this area is full of neutrophilic extracellular trap. So this is how neutrophilic extracellular trap name was given. Extracellular, outside the cell, and they're coming outside, they're forming the trap, they're trapping the antigen, they're killing them. So that is why when they will kill this antigen, after that there is no nucleus, so they will not be surviving, they will be dead, and that is why it is called as beneficial suicide. So this diagram we have to keep in mind, and this picture also we have to keep in mind. This is the electron microscopy, right? This is the electron microscopy. In this electron microscopy, what we are observing, this is the neutrophilic extracellular trap. This is this thin cloth or fiber like structure which is going through. These are the chromatin, neutrophilic extracellular trap, and this round structure, these are the bacilli, right? These are the staphylococci, not bacilli, staphylococci. You can say staphylococci. These are cocci, right? Round colors. So these are all round. So these are all cocci. So this is how bacteria, so you can see in simple words, bacteria is trapped by neutrophilic extracellular trap, right? So this is how neutrophilic extracellular trap prevents us from the infection. So that is the most important function, right? So we have seen neutrophilic extracellular trap, their images, their electron microscopy. Now we are going to see another important topic which we have seen in cellular events of acute inflammation, that is called adhesion molecule. Very important topic for exam point of view, adhesion molecule. So adhesion molecules are important in inflammation. So what are the adhesion molecules? What are the adhesion molecules? So adhesion molecules, we can divide them into following 4 families, right? Number 1 is called as selectin adhesion molecule. Second is known as integrin adhesion molecule. So selectin, integrin. Number 3 is immunoglobulin molecule, and number 4 is mucin like proteins. So these are the 4 important adhesion molecules: selectin, integrin, immunoglobulin surface molecule, and mucin like protein. All 4 were given in one of the PGI exam, right? Which of the following is our adhesion molecule? So now you can see all 4 are adhesion molecule. Now we will see one by one. What is the selectin, right? What is the function of the selectin? You can see the name of selectin itself is telling that selectin is required for cell to cell interaction. So cell to cell interaction is the function of selectin. So selectin is required for cell to cell interaction. One cell and how they are going to adhere to another cell will be decided by selectin. So cell to cell, selectin. So the name itself is telling selective function. Cell to cell interaction will be selectin. Whereas when we talk about integrin, that was the All India question also in 2014. What is the function of integrin? Integrin main function is for cell to cell as well as cell to matrix. So cell to cell and cell to matrix, both of the above is the function. So integrin is required for interaction between cell to cell also, and cell to the matrix also. So cell to matrix, both will be performed by integrin, right? Immunoglobulin molecule, you have seen earlier in our discussion, there was a one molecule called pCAM1, right? You remember pCAM1 CD31, which was the most important adhesion molecule for diapedesis. So pCAM1 is a immunoglobulin molecule, and that time also I told you it's an immunoglobulin molecule whose marker is CD31, right? Now coming to the fourth one, mucin like proteins, they are usually present in extracellular matrix, and this is member is heparan sulfate, right? So their member is heparan sulfate. So mucin like protein and their member will be heparan sulfate. So these are the four important immunoglobulin, four important adhesion molecule, right? These are four important families of adhesion molecule. Selectin, here I want to emphasize, because this was also question in All India exam, there are three types of selectin. So here we must understand there are three types of selectin molecule. Remember, there are three types of selectin molecule. What are these three types of selectin molecule? One which is present on platelet. Remember, one which is present on platelet, they are called as p-selectin, right? So here P stands for platelet. So when they are present on platelet, this is called as p-selectin. When they are present on endothelium, they are called as E-selectin, right? E-selectin for endothelium. So when they are present on endothelium, E-selectin, and when they are present on leukocyte, they are called as L-selectin, right? So this is called leukocyte, L-selectin, right? So these are leukocyte, L-selectin, P-selectin, E-selectin, L-selectin. These are three types of selectin, and we must remember, for all the selectin, CD marker is CD62, and this could be your future question in exam. So just remember this point, CD32 is CD62 is another name for selectin adhesion molecule. Remember this name because in Robbins it has been used very frequently. An examiner may ask this question in future exam. CD62P, CD62E, CD62L. So these are the annotations which had been used in textbooks and our books, right? Which is for selectin adhesion molecule. 62E will be endothelial, 62P will be platelet, 62L will be for leukocyte, right? What is the function of integrin? That was the All India question in 2015. What is the function of integrin, right? So what are the function of integrin? Question was like this, which of the following is not a function of integrin? Which of the following is not a function of integrin? So we will understand what are the function of integrin. Number one, integrin is required for adhesion. Integrin is required for arrest. So after adhesion, arrest. And after arresting, they will be having transmigration. So these are the three important functions of the integrin: adhesion, arrest, transmigration. So these three were options which were correct options. So what is not a function of integrin? So answer was rolling is not a function. Rolling is not a function, and rolling is performed by which adhesion molecule? Rolling is done by p-selectin. If you remember, I have told you already that p-selectin is having only one function, that is called rolling, right? So that was the question in All India exam. P-selectin is required for rolling only, right? P-selectin is required for rolling only. So that was the All India question, right? So now we have seen this adhesion molecule. Now I am going to tell you what is the clinicopathological correlation of this adhesion molecule. That is also very important, right? What is the clinicopathological correlation of this adhesion molecule? Clinicopathological correlation, CPC. In short, we will say CPC, clinicopathological correlation. What is correlation? Whenever this adhesion molecule is defective, right, they will be giving rise to disorder of the leukocyte, and thus such disorders are called as leukocyte adhesion defect disorders. In short, we used to write LAD, leukocyte adhesion defect disorder. So these are leukocyte adhesion defect disorders. So you can see, in short, we say leukocyte adhesion defect disorder. So leukocyte adhesion defect disorders, they are hereditary disorders, and they are autosomal recessive disorders, and they are also associated with primary immunodeficiency. Right? What is characteristic of leukocyte adhesion defect disorder? When you will see this patient and you examine their peripheral blood, will you find increased leukocyte count or decreased leukocyte count? So it's very simple to understand. If you look at this diagram which I am showing you here, suppose I am making it is a blood vessel, right, and just I am showing you this is the bacteria who is sitting outside, right? So when bacteria is sitting outside and it is giving inflammatory stimuli to the blood vessel, what should be the correct event? To the neutrophil or to the leukocytes? Leukocyte count should be increased, right? Leukocyte count should be increased. Now come to the point. This is the leukocyte adhesion defect disorder, right? Adhesion defect disorder means this adhesion molecules are absent. So if adhesion molecules are absent, see what I am writing here. Adhesion molecules are absent, they are not present. So when adhesion molecules are absent, so what will happen? This neutrophil will not come out, right? This neutrophil will never come out. So as a result, they will remain in the blood flow, right? They will remain in the blood flow. And in this scenario, when you will put the needle and syringes, to take out the blood sample, what you are going to see? Neutrophilia or neutropenia? Neutrophilia, because number of cells are more in peripheral blood who are circulating. So that is why you will always see neutrophilia or leukocytosis. Neutrophilia or leukocytosis. This was the All India question, right? So leukocytosis or neutrophilia will be seen in LAD disorders. So that was the right answer in exam. Neutrophilia or leukocytosis will be seen in leukocyte adhesion defect disorder. Just imagine if leukocyte is not coming outside, then will you see pus in this case? Because what is pus? Pus is consisting of all this inflammatory cell debris. So there will be no pus. Neutrophilia without pus formation. So that is another important feature. Neutrophilia or leukocytosis without pus formation. So without pus formation. So this can be another future question which examiner can ask you. Neutrophilia without pus formation is a feature of which disorder? This is how question will be asked. Neutrophilia without pus formation is seen in which disorder? Answer will be leukocyte adhesion defect disorder, right? So these are important point about certain features of the leukocyte adhesion defect disorder. Here I will tell you LADs, leukocyte adhesion defect disorders. They are of three types, right? LAD1, LAD2 and LAD3, right? We will see some of the salient features of LAD1. In LAD1, What is the defect? So what are the defects in all these LAD disorders? So LAD1 defect lies in beta 2 chain of beta 2 integrin. So beta 2 integrin, beta 2 chain is defective. So this is the defect. So defect in LAD1 is beta 2 chain of beta 2 integrin, right? Whereas in LAD2 defect lies in sialyl Lewis ligand. So sialyl Lewis is defective. Sialyl Lewis is defective in case of LAD type 2. LAD type 3 is little unique. Here there will be mutation. There will be mutation in a gene called as FORM-T3. FORM-T3. So mutation in FORM-T3 gene. So mutation in FORM-T3 gene will be present in LAD type 3, and because of this mutation, there will be no activation of beta 1, beta 2 and beta 3. These are three types of integrin. So none of them will be activated. So mutation in FORM-T3 gene will be responsible for no activation of beta 1, beta 2 or beta 3 integrin. So these are the defects. Comparison of the defects between LAD1, 2 and LAD3. Right, now we will see what will be the characteristic feature. Already we have seen they will be having neutrophilia without any pus formation. But now I wanted to categorize some of the important features which examiner ask in exam. LAD1, what is the characteristic clinical feature in LAD1? So LAD1 characteristic clinical feature is delayed separation of the umbilical cord stump. Delayed separation of umbilical cord stump. Delayed separation of umbilical cord stump will be seen in LAD type 1, right? LAD type 1, delayed separation of umbilical cord stump. This is the very important and quite frequently asked question in All India exam. Delayed separation of umbilical cord stump is seen in LAD1. When you will say this is delayed separation, when separation of umbilical cord is beyond 30 days of the birth. So that is also one important point to remember, beyond 30 days of the birth, right? LAD type 2, they will be having association with mental retardation. So this will be having mental retardation, association with mental retardation. And there was a question in All India exam 2016, which blood group is associated with LAD2? Because of the deficiency of sialyl Lewis, here they will be having association with the Bombay blood group. So LAD2, remember this question, LAD2 is associated with Bombay blood group. LAD2 association is with Bombay blood group. So they are associated with Bombay blood group. So LAD2 is associated with Bombay blood group, and that was the question in All India exam 2016. Bombay blood group is associated with LAD2. There was another question in All India 2017. A patient was having bleeding, platelet disorder and immunodeficiency. Most likely which LAD? So all LADs are primary immunodeficiency disorder. Already we have discussed, right? So already they are having primary immunodeficiency, but along with this, LAD3, their clinical feature will be having bleeding like a platelet disorder. Bleeding like a platelet disorder. So bleeding like a platelet disorders will be there in this LAD3, and here examiner had given the name of Glanzmann's thrombosthenia, a platelet functional defect disorder. Glanzmann's thrombosthenia. Right? So this point we have to keep in mind, that bleeding like a Glanzmann's thrombosthenia. So bleeding like a platelet disorder, Glanzmann's thrombosthenia will be present or bleeding will be like a Glanzmann thrombocythemia in case of LAD3. So these were the questions which examiner had asked in All India exam, and this is the clinical correlation with the disorders, right? This leukocyte adhesion defect disorders.